Hi, my name is Heidi. I'm the CEO of Aware Health, and we offer smarter musculoskeletal care for a stronger workplace. We work with employers like you to decrease their number one cost, which is musculoskeletal pain. So it's more costly than cancer, diabetes, heart disease, and this is because employees have orthopedic pain. Almost 1 out of every 2 employees have orthopedic pain. So it's so frequent that it costs so much. And in the insurance-based system, physicians are pushing everyone towards imaging that's unnecessary and ultimately surgery if nothing else works. You can tell in the insurance system, it's mostly passive treatments. So we know through research, active treatments are more effective than passive. So passives like manipulation, medications, injections, ultimately surgery. So we offer an on-call number and we get employees on our schedule the first day that they experience pain. And so we fast track the whole process. And this is good for your financial health of your company because it's your number one cost and we can reduce that cost by 50% based on our previous data with companies. And this leads to employees being happier because they have less pain and healthier. They're back at work and are more functional, and they stay at their job more because they're less stressed. And I can give an example of that later. So this is just a visual. And on the top, you can see some people don't even report their pain right away. And then they go through physician appointments, oftentimes injections or extensive physical therapy and surgeries. So our average number of visits for physical therapy is very low. It's only 2 or 3 visits and people are getting better. So it's less extensive program and more quick results with it. And so you can see down here, this is with Aware because we start treatment early. It doesn't take as many visits. And the cost for telehealth is just $12 a month compared to the costs quoted above here. So there's huge cost savings to be realized. This is a pilot that we did with another company for 6 months, and their spend reduced from $91 per member per month to $25 per member per month because people were reaching out to us. And the net promoter score was 94%. So people were really happy with the service. And if this seems too good to be true, I listed the contact for that employer in HR, and she'd be happy to talk with you if you want to verify any of this. This is just a couple videos here. This is one employee who came to us and was ready to quit his job. He said, I hate my job, I'm gonna quit. So this is his experience.
I found out about the Aware Health program at one of my company's safety meetings last year. It seemed like a really great program because of how flexible it was to attend. In my line of work, we are living out on the road and we're rarely home, and doing an in-person meeting is nearly impossible. So it was really, really helpful that you could do this on your phone or a computer just about anywhere if you have connection. And I started the program with having problems with back pain and dealing with a lot of work frustration. And with help from Heidi and Aware Health, I was able to receive some ways to work on my back pain, helpful techniques and ways to do stretches that help alleviate some of that soreness and pain, and also creative ideas and helpful ideas on how to cope with the day of work and not be so stressed out. When I started the program, I was probably smoking about a pack a day of cigarettes, and it's been almost over 6 months, almost a year, I think, with the program, and I have far less back pain than when I started, and I'm no longer smoking cigarettes. And for quite a while there, I was really seriously thinking about looking for another job and quitting this line of work due to how stressful it was. And thanks to Aware Health, it was really, really helpful in finding ways to, I wouldn't say cope with it, but have a whole new outlook on, coming to work and enjoying this job. And it was a big help in dealing with the stresses that come with this line of work. And I'm now still working at the same company, and I got a seat at this table, and I'm not getting up for anybody.
So that was one person's experience, and he decided to stay at his job after we worked through some of the work frustrations. And then this is another employee from a company.
I found out about the.
Hi, my name's Robert. I just wanted to take a minute to give a big shout out to the Aware Health team. Having driven commercial vehicles, operating equipment over the past 30 plus years, it's really taken a toll on my shoulders and my neck. About 6 months ago, I was having a lot of pain. Went to the doctor. He said, take 800 milligrams ibuprofen. Here's a referral for an MRI. You're probably going to need surgery. It's like, oh, great. So went home, was talking to my wife, said, hey, you should try this new program through our insurance called Aware Health. They might can help you. So I called them up, got an appointment. About 6 weeks ago, I started the program. It's been remarkable. I can raise my arm above my head. I can steer the forklift. I can steer the steering wheel. All these things. 6 weeks ago, I couldn't do. I had a dead arm. I was kind of doing the dinosaur thing. That's all I could do. So anyway, I just wanted to give them props. They really know what they're talking about. Great people, great program. Have a nice rest of your day.
So these are some of our clinical outcomes, and on average, including those who dropped out, which is only 6%, so we really high adherence. There's a huge increase in physical function and a decrease in pain. And this is important so that we also realize this is like chronic pain, because this is the beginning of working with a company. So this is on average as well. So if it's acute pain, people usually go down to 0 pain by the end. But if somebody's had 10 years of pain, then, we try to decrease their pain considerably still. So these are some of our outcomes, and this is our contact information. And we look forward to talking with you more about this.